Some of the potential questions for viva and rabbit eye experiment. Histamine receptors H1, H2 and signaling pathway. How do H1 and H2 receptors differ in their signaling pathway and physiological effects? H1 receptors pathway coupled to GQ11 protein activates phospholipase C (PLC), increases IP3 inositol triphosphate and DAG diacylglycerol, leads to intercellular calcium release. Ocular or smooth muscle effect causes smooth muscle contraction, example bronchoconstriction, gut contraction, and vasodilation by ano release, increasing vascular permeability, triple response of Lewis, conjunctival edema, and chemosis. H2 receptors pathway coupled to GS protein activates adenylyl cyclase AC, increases intracellular CMP, activates protein kinase A, PKA, stimulates gastric acid secretion, parietal cells, and causes cardiac stimulation, positive inotropy, chronotropy. Quick examiner summary. H1 is GQ, PLC, IP3, DAG, calcium, leads to inflammation, smooth muscle spasm, allergic reaction. H2 is GS, AC, CAMP, PKA, leads to gastric acid secretion, cardiac stimulation. Adrenergic pathway, ocular receptors. What are the main adrenergic receptors in eye, their pathway and their effects? Receptor alpha 1, radial muscle of iris, dilator pupillary, signal transduction, GQ, PLC, IP3, DAG, intercellular calcium. Alpha 2, ciliary body epithelium and presynaptic terminals, GI, inhibit AC, decrease in CAMP. Beta 1 and beta 2, ciliary epithelium, GS, stimulates AC, increases CAMP. Alpha 1 receptor by GQ pathway cause mydriasis, active pupil dilation, light reflex remains intact. Alpha 2 receptors by GI pathway inhibit AC, decrease CAMP, decreases aqueous humor formation, increases uvosacral outflow, example apraclonidine, brimonidine. Beta 1 and beta 2 receptors by GS stimulates AC, increases CAMP, increases aqueous humor secretion. Beta blockers like timolol block this to reduce IUP. Ethacrinic acid, ocular effects in animals. What is the ethacrinic acid's mechanism and effect on intraocular pressure IOP in dogs and rabbits? Ethacrinic acid belongs to class loop diuretic phenoxyacetic acid derivative. Mechanism of action in the eye inhibits the sodium potassium chloride co-transporter in the trabecular meshwork TM cells, induces cellular swelling, cytoskeletal reorganization, shape alteration of trabecular meshwork cells, widening the intracellular, induces cellular swelling, cytoskeletal reorganization, shape alteration of trabecular meshwork. Ethacrinic acid induces cellular swelling, cytoskeletal reorganization, shape alteration of trabecular meshwork cells, widening the intercellular spaces of Schellem's canal. Effect in dog and rabbits. Significant reduction in intraocular pressure IOP. It acts as a cell shape altering agent to markedly increase trabecular outflow facility, conventional outflow pathway. Clinical significance, used as an experimental prototype for trabecular outflow enhancing agents similar to the modern ROCK inhibitors. Pathway of light reflex, tracing the direct and consensual pupillary light reflex pathway. There are two pathways, afferent and efferent pathway. Afferent pathway, sensory cranial nerve second, retinal photoreceptors, optic nerve, optic chiasma, decussation, optic tract. Preductor nucleus midbrain, bypass the lateral geniculate nucleus. Efferent pathway, motor cranial nerve third, parasympathetic. Preductor nucleus, bilateral EW nuclei, oculomotor third, two ciliary ganglion, short ciliary nerves, sphincter pupillae muscle, pupillary constriction, meiosis. Viva key, consensual light reflex occur because the pretectal nucleus sends fibers bilaterally to both the ipsilateral and contralateral Edinger-Westphal nuclei by the posterior commissure. Circular muscles of iris, sphincter pupillae. Describe the autonomic innervation, receptor type and drug effects on circular muscles. Circular smooth muscle fibers surround the pupillary margin. Contraction decreases pupil diameter, meiosis. Innervation, parasympathetic fibers by the oculomotor third cranial nerve originating from the Edinger-Westphal nucleus, synapsing at the ciliary ganglion. Receptors, muscarinic M3 receptors coupled to GQ protein. Pharmacological response: agonist, example pilocarpine, physostigmine, stimulates M3, leads to contraction, leads to meiosis. Antagonist, example atropine, cyclopentolate, blocks M3, leads to relaxation, paralysis, leads to passive mydriasis plus loss of light reflex.